So, good evening, everyone. Okay, so we are live now. As I can see, we are live on Facebook. And while we wait for our viewers to join, for those of you who are already joining us, please do put up your questions. Good evening, Suresh Nimi Kumar. Please put up your questions. And we will be just beginning in a minute or so. Dr. Om Prakash is with us and Dr. Jayashree is also here.
Hello. Good evening, ma'am.
Good evening.
Good evening.
So, okay, so let me begin. And I would like to extend a heartiest welcome to Dr. Om Prakash for joining us on our second online support group meeting for dementia. Dr. Om Prakash is a MD in Psychiatry, Associate Professor at Institute of Human Behavior and Learned Sciences. He has earlier worked at NIMHANS and at PGIMA Chandigarh. Dr. Om Prakash is highly felicitated and a renowned person, and I believe, sir, you are into geriatric and aging issues for a very long time, and that's very heartening to see your dedication and commitment to that. And you have received various honors like ICMR, Tilak Venkoba Rao Award, Surinder Marva Award in Geriatrics, and a lot of other recognitions you have from various scientific and industrial bodies. So it's a great honor to have you here with us, sir, today. And I also see that you have interest, you have special interest in dementia, in stress, dementia-related stress, as well as geriatric depression and caregiving issues, which is what we'll be talking a lot about in terms of how dementia impacts the patient, but also the family in the whole journey of the ailment. So I also like to welcome my colleague, Dr. Jayashree Gupta. All of you know her. She's co-founder of Samvedna Senior Care. She's a clinical psychologist from NIMHANS. And she also has a very active interest in Alzheimer's as well as children and autism. So over to you, Jayashree, to kind of lead the conversation and start your discussion with Dr. Om Prakash. And we already have some questions also. I don't know if you can see them, but I'll be putting it up. So Jayashree, over to you.
Thank you, Archana, and thank you very much again, Dr. Om Prakash, for joining us today. Just to let the people who are joining in know, this is our effort to engage with caregivers of dementia. We've been holding regular support group meetings at Samvedna since many years. During these times when we're unable to travel, this is an opportunity for us to engage with dementia caregivers through the use of technology. It's also a really great way for us as a community of caregivers to share our experiences, maybe with people whom we would not have had a chance to interact with if these were actually face-to-face meetings. So I think there are positives to the whole COVID situation as well. With that, I'd like to invite Dr. Om Prakash to share his thoughts on one of the most commonly asked questions that we have from people about how do we recognize the initial signs of dementia? What exactly is dementia? Dr. Om Prakash.
Yeah, I think we just lost him. He just dropped out.
Unfortunately, I think that's the ups and downs of technology. But as we're waiting for him to join back, I would encourage you to please type in your questions into the chat. We will do our best to address as many questions as we can. Dr. Om Prakash is a wealth of experience and knowledge regarding dementia and its care. So do utilize this time to just put down any questions that you have, and we will definitely do our best to address these questions.
Yeah. Yeah. So I think he's back. Yes. Okay.
Yeah,
So the first,
some
good to
problem is
have you
there.
back.
I think this is one thing. Yeah, this slide is very interesting. I find, and this is Beatles one group. Some 15 years back, 50 years back, they say very interesting thing. This group told, "Will you still need me? Will you still feed me when I'm 64?" I think this is something very touchy. Means we all the time say. Next slide, please. We all the time say that how life turns, and the
Yeah.
time of COVID when I think what we are facing, the pandemic. This is something maybe almost 1 century back we faced that part. And see the life, the way we move and uh, the way we going through. I think that's a very toughest time we are going through. One thing we heard about, say, heart failure. We said this is brain failure. So the dementia is something. What you today talking about brain disorder called dementia. This is called brain failure. This brain failure is something like that. What we say, if it's a next slide, there is somewhere there's shrinkage of the brain. In common words, we can say brain brain come over there. So what the confusion, the flow? If you see the right slide, something we can make out that things somewhere this oxygen diffusion, the shrinkage in brain. That's the form of a thing. Please, please, please. Normal being, we out somewhere. The normal
I think we are having some audio
day
issues at your end. Just a second, sir. We are having some audio issue at your end. So just your audio is a little challenging. Jayashree, would you like to start with some of the basic
So
things?
I think maybe I can just rephrase what Dr. Om Prakash was mentioning.
Yeah.
He was describing how we talk of heart failure, and dementia is one way that we can look at it is as it being brain failure, and this is and the very interesting images. If we could just go back to the previous slide, Archana, that he's put up over here, are really showing the way in which there is a shrinking of the brain. And this is what we actually see if you were able to look at the brain with dementia. So I think hopefully we will have Dr. Om Prakash back. Dr. Om Prakash, yeah, great to have you back.
Hello.
Yeah.
Yeah, now can you hear?
Yes, sir.
Hello.
Yes, I hear you. Yes.
Sorry, the audience, because somewhere we are talking about dementia. So memory, this internet memory is going, coming and going. So just be inconvenience what is happening here, and what the internet things are coming and going. This is something happening in the brain also. What happened? What lost in brain is never come back. That's the dementia. You understand that things go on in the brain that go on. So what feels
Yeah. So Jayashree, I think we have lost Dr. Om Prakash again. So maybe you want to take over
So,
And
okay, let's maybe go down to the next slide.
okay, okay.
Um, I think that's a very interesting point that Dr. Om Prakash was making, that once something's lost from the brain, unfortunately, this memory loss that he was describing uh, is something that doesn't come back. And that's unfortunately something that gets impacted in dementia. So there is a memory loss that actually disrupts the daily life. Um, shall we maybe move on to the next slide?
Yeah, so maybe
Uh,
we can take a question in the meantime. So there is a question is I'll take this question. My question is how dementia caregivers avoid getting burnout or fatigue. So I think we'll be talking a lot about this today. But Jayashree, you want to comment on this while we are waiting for Dr. Om Prakash to join back?
Yeah, this is, thank you, Jyotika, for this question. This is a very, very important thing that a lot of caregivers of dementia experience. One of the ways to avoid burnout or caregiver fatigue is when a person becomes very overwhelmed by fulfilling their caregiving responsibility, when the whole process of providing care actually becomes very challenging and overwhelming for them. And one of the reasons why this becomes so difficult is because they are losing out on the very important aspect of taking care of themselves. So, one important thing to do is be aware of when you're experiencing this stress or this burden of feeling stressed out, and take a break. So I see that Dr. Om Prakash has joined us back. Let's hope that his connection helps us this time.
So Dr. Om Prakash, can you hear us? Hello? Hello? Yeah, I think. Um, okay, so let's just clarify that. So there's another question. My father is dementia patient and now refusing to eat. Very little intake. So is tube feeding an alternative? So Dr. Om Prakash, maybe this is something you would like to address.
This slide is I think somewhere you'd understand that what I started with about memory and means the person with dementia not able to make out the new information like something suppose we asked okay what you ate in the morning hours, who came to your house, he not able to make out means somewhere the problem happen in the storage of memory, so that new information not getting stored, old those things what is something in 30 40 years that is preserved, but the new information storage some problem is happening. That's the basic hallmark for dementia. This is a very important thing. Means persons may remember something happened after at the age of 40 years, 50 years, but not able to make out what happened last 10 days, what happened almost last 1 month. So the problem, if it's something the hallmark is somewhere recently learned information, persons forget. That's very important. If you go to the next slide, please.
Yeah,
Next slide, please.
yeah. Challenges
So
in managing.
somewhere, yeah. So the challenges in what are the problems is there? Suppose uh, some guest come to the house and because ask okay वो मेहमान आएंगे उनको बैठा लेना घर पर. So he not able to make out what to do. Means the guest entered the house and he say he just clueless. So what happened? Any problem is supposed to give the person. He not able to make out. He not able to focus, and that may not able to finish the accomplish task. That is issue very important part of that challenge. Next slide, please. Because these are the warning signs for dementia. When to suspect the person having dementia? Like in make out that routine complete daily tasks means the person used to go to kitchen every day, supposed to do all say all household chores somewhere the routine tasks not able to make out. He find with difficulty, like he's driving earlier, maybe 2 years back, but not able to hold the key and how to drive, where to put the key. He not able to make out. That's very important part, and in dementia happen. Next slide, please.
Yeah.
So problems happen in dates, making out time, what happening there, what happening around, what's happening all around. Maybe because this is a COVID time, we're not able to make out what is happening outside because you're spending a long time at home and you're not able to make a season, what is summer, rain or rainy season, you're not able to make out. That's the problem with the time, person, or place. You're not able to make out the time. What a time of the day. Next slide, please. So a problem in understanding the visual images. So not able to make out the what is distance. Suppose we're supposed to say, okay, how far is home from hospital from here? You're not able to just the distance about. You're not able to make out the color. If you say this is the green or blue or he get confused about that whole understanding the visual images and what relationship between the different place or distance and that way. And even seeing the mirror, he not able to be like, oh, somebody's there. He may confuse in that way, even seeing the image also. So this is very interesting because when we check any person with dementia suspecting, and we can say, oh, okay, what is this? This is pen. Oh, this is pen. So he say something for writing, something okay. What is this? Let's say when you knock, oh, this is something hand clock. He not finding, okay, what is, oh, fan. No, this something is moving and giving the air. I can make out, but I couldn't find the words for the what to label that phenomena. So he not able to. He's searching the words. He's juggling the words, struggling the vocabulary of the words, and uh, at times he stop conversation. At times he's lost in thoughts. Where he started, what he started. So that's the and same problem in the writing also. So if you get the writings, okay, one page writing about the person who is already, say, good academician, he asked to write. Sometimes the words, pronunciations, full sentence format. So in that way, he find very he juggle in that way. That's very important. I think we can okay. We supposed to be one. Oh, maybe the person having dementia. Next slide, please. So he lose the say person somewhere in the car, somewhere in the shop, and he say, okay, no, I lost somewhere. I don't know where to lost, and he spend a lot of time in searching that lost pen or purse or key or putting key in the refrigerator. He forget where he put the key. So somewhere he lost the key in the
Yeah.
Um,
Poor judgment decreased. Yes. But
so problem in judgment. Yeah, that's important. He not able to decide about the money things, shopping. He not able to pay attention about grooming, how to look after himself, how to make clean himself. So the problem, the personal hygiene happening, problem in taking decisions about day-to-day things like money, like maid come, not come, who are they, who are the persons. He not able to decide about the actual planning, what's supposed to do about the whole day and what was supposed to do whole day in grooming and all, keeping himself clean.
ये amotivation और withdrawal ये बहुत
Slide
common
change, please.
symptom है. डॉक्टर ओम प्रकाश इसके बारे में थोड़ा सा और बताएंगे?
Slide change, please.
हाँ जी, मैंने कर दिया सर स्लाइड चेंज. Changes in mood and personality.
ये इम्पोर्टेंट है कि the person's getting dementia, he just start
Yeah.
withdrawing himself from धीरे धीरे अपना जो काम है अपना जो जो like
So I think we're having some difficulty.
TV program. He what had engagement in say uh, this is something and slowly and gradually he became confused, he's suspicious, depressed.
Hmm.
And I think what Dr. Om Prakash was describing was how a person with dementia often experiences changes in their mood and personality. So they may become very depressed, maybe become very fearful or irritable, very anxious, and um, they can. This can happen anywhere. This can happen within their home, or even when they're in at work or at a place which they're uncomfortable in or unfamiliar with. That's particularly a place, time for concern, because those are times where these kind of symptoms increase and become more problematic. So this is again another warning sign that people with and personality change that we often see in people who have dementia. Um, so I think Dr. Om Prakash is unfortunately having a lot of connectivity challenges, but we hope that he would join us back soon. And
Yeah, sorry for that. I think sorry for all Facebook audience who are seeing us, and I think we are okay. Just to sum up what happened till now, we discussed, and this is very important thing. And I think when do we watch that we suspect dementia is there? First, problem in recent memory. Second, important that person not performing familiar activities of household any activities. Problem in language, problem in orientation, problem in judgment, problem in the personality, problem in the doing familiar things. For next slide, please.
Yeah.
So these are the misplacing things, problem the mood, behavior, personality, mood. So those things come up when we suspect okay, this is the time we're supposed to take this person to doctor, and that's the I used to say most of the audience says important that identification because you identify the person like this is very simple ABC of dementia means if we start to see means memory problems are there, so you suspect okay something is there in this person that I suppose is the doctor, anyhow I suppose is the doctor. Before behavior problems, if it's something problem in mood swings, something sleep problems, some problem in some psychotic symptoms are there, something. Or last very important problems ADLs means he's not going to washing, dressing. He don't know basic routine activities. How to use the mobile, how to use the pen, how to go move out, how to use the driving. All skills get impaired. So this ABCs is very important. Means we can make out. Oh, this is the person we need help. We need supposed to go to health professional to at least treat or diagnose the person. Next slide, please. Why the diagnosis is important? That's what I want to share. Next slide, please. Because the moment we diagnose the person dementia, this is totally downhill course. The person supposed to be go down, down, and down. As the time passes, the person initially has memory problems, then followed by all sort of psychotic symptoms, and slowly, the person get retarded. And the last. because brain seems so way on every ultimately the person become maska lothera means something like he's not he become vegetable and these persons are dementia or the period of time they may die due to not due to the brain system case they more die due to infections means the person with dementia get diagnosis they need care and care like we used to look after our kids so बच्चों की तरह उनका ध्यान रखना होता है जब जितना भी भगवान ने उम्र दी है उस उम्र के साथ साथ हाउ वी कैन एटलीस्ट वी कैन हेल्प देयर लाइफ मोर कंफर्टेबल नेक्स्ट स्लाइड प्लीज so this is something very important I used to say uh, almost when I joined my MD at that time there is no medications for dementia in India. I'm talking 20 years back and now we have drugs are there they costing 500 rupees per month to roughly 2000 rupees per month. This the time because the moment person go diagnosed with dementia we supposed to start early we supposed to start the drug don't postpone the drug why because जो चला गया मैं ब्रेन का पार्ट चला गया जो बच गया हमें उसको बचाना है उसकी प्रोग्रेस को स्लो करना है दैट्स आवर टारगेट that's why our all means medicines our psychosocial intervention helps so पेशेंट और फैमिली को हमें ये समझाना होगा लर्न करना होगा कि बीमारी से कैसे लड़े आज हम कोविड से संघर्ष कर रहे हैं सेम डिमेंशिया भी एक संघर्ष है परिवार को पेशेंट को हम कैसे सिखा पाए हाउ टू कॉप अप विद डिजीज नेक्स्ट स्लाइड प्लीज and the problem we find I think very important why we stuck and this happen not with only patient and family they poor reporting our own doctors our own doctors they hardly bother about elderly person as say per se but they ignore early signs of dementia so somewhere families patients we health systems a lot of people is helping that we we supposed to intervene at the early stage we're not able to make out and those things time and cost these are other issues which help in they put barriers in the early diagnosis I think we have
And that is
to
a challenge I think Jayashree
one break madam archana please
नहीं ये आपने जो बोला बैरियर्स टू अर्ली डायग्नोसिस आई थिंक दिस इज वन ऑफ द बिगेस्ट चैलेंज वी आल्सो फेस हमारे पास लोग आते हैं मोस्टली काफी लेट स्टेजेस में जब बहुत हम कम कर सकते हैं जैसे आपने कहा जो बचा हुआ है उसको बचाना है so which is very well said sir sorry sir please go ahead
So, whilst we're just waiting for Dr. Om Prakash to join us back, I think we've got a number of comments on Facebook, and I'd like to thank the viewers for sharing their comments. Definitely, I think some of these questions have already been addressed by Dr. Om Prakash. He's briefly touched upon the number of the various stages that are there. The aim of dementia treatment, as Dr. Om Prakash was suggesting, is really to identify the illness onset as early as possible. हम लोग कोविड के पहले हम लोग actively screening camps करते थे. I mean, we hope to continue this once things open up again. But early identification is very, very important. We can slow the progression of the illness and save whatever fact and really try to support whatever remaining faculties are left when if we identify the patient early on. Sorry, over to you, Dr. Om.
Yeah, this is something because somewhere because of the target our prevention of disease that I started with. So we delay the onset, we slow the rate of the progression, and what the problems happen either symptoms are there, we can manage with drugs. There are good drugs are there. Believe me, last 20 years, good drugs are available in India about managing the behavioral problems. Next slide, please. So I say I started with the medicines. They are basically target is to prevent what happened. The brain hormones are there. So acetylcholine, the hormone which help supposed to help in memory and thinking. These drugs, they suppose these hormones get lower down because of the disease. Somewhere these drugs help in preserving this hormone. This acetylcholine they're supposed to preserve. So that's the target, whole target of these medications. If we start early, definitely we make patients' life more comfortable. Next slide, please. And this newer drug like memantine again is in another way this chemical brain chemical works. So again, this is something helping another theory of say brain law, that's a glutamate. So this is again the way it acts to prevent the preserve the memory and somewhere helpful in the moderate to severe dementia. Yeah. So I think we have a lot of questions, Madam Rachna.
Yes, sir.
We can,
Yes, sir.
yeah, yeah.
So we can,
So we can like discuss these questions. Yeah.
yes. So I think there was one question in the beginning which I tried to put up multiple times. So we can answer this. My father is dementia patient and now refusing to eat, very little intake, is tube feeding an alternative.
I think that's the because of this COVID time and because and what I say that dementia is as the time passes, most of the systems did not respond. Same with GIT system, gastrointestinal system. Uh, Multiple meals, small meals every 3 to 4 hours. Something which is palatable. Uh, Sanchit, you can try that way. You can multiple small meals. What your father eats that way. You could try those meals, frequent meals possible. Two feeding I not advise because you're supposed to be feeding is not one day process. You feed the whole months and years. So again, the chances of two feeding, that perforation, that infection, those things are there. Hygiene is a very important issue. So I wish if you can try liquid diet, if you can try multiple meals, if you can try what a father tried to eat, let's try that way rather than two feeding. Two feeding is the alternate when you think that is impossible. Then definitely, I wish that I think you can better admit. Then you can go to two feeding. If you can manage at home with nurse, it's okay, great. Then no issue.
Yeah. Thank you, doctor, for sharing that. So there's a question from Richa Chadha that if we address the issue that causes dementia, can the progression be stalled? So I don't know what is the answer to that.
Uh, this is something my Australian UK friend they're trying is can we find the answer for dementia? Means can we stop the progress? Uh, don't know, don't know. Maybe we don't know. Uh, Maybe or 1 or 2 decade we don't know. The lot of believe me, millions of dollars are research is spending just to find this answer that can we stop dementia, like vaccination for dementia. uh, Three continents, UK, Europe, and USA, their trial failed. Australia trial is still going on. So people are finding different multiple answers to stall dementia. But more important, can we identify dementia early? That's more important. Can we prevent dementia? That's more important. If I have family history of dementia, so I should try for preventing dementia rather I should go inside. So I should have cognitive changes then I let try say I got dementia. So difficult answer, but maybe I don't know. After 1 or 2 decades, we answer for that also. Thank you, Richard.
So, sir, this is a question which is a tricky one. Like, how dementia is different from insomnia, and I think you talked about it, that how initially people fail to diagnose. So, would you like to comment on this?
Yeah, insomnia is sleep disorder. This is something lack of sleep. Dementia is complex. It's complex syndrome of multiple signs and symptoms. Sleep could be one part, one sign, it's not the whole. So dementia is something like we say this everything under the umbrella of disease is dementia. This almost all psychiatric disorders, they have some sign symptom. They may have in dementia. So this is syndrome basically, big syndrome having multiple sign symptoms, multiple set of symptoms. So this is totally different from insomnia. Insomnia is loss of sleep, but could be one sign for dementia.
Yeah. So there's a question from Kritika. How do I get my other siblings to understand that some of the behaviors, such as shouting, abusing from mom, is the disease and not the mother? I think a lot of people struggle with this, in terms of the person behind that has gone. So,
I all the time say family meeting. Answer is family meeting. I used to say one slide also there later. Cry for help means you have all siblings just sit together under one roof and understand this is disease and disease and disease. What uh, Pritika's mother is doing, I think, let her sibling also understand, make understand this is disease. What behavior her mother is showing in this part is exhibiting these behaviors. This is a part of the illness. It happened. So somewhere Pritika is supposed to work hard or take help of maybe Samvedna Care. They will help her at least to have family gathering, family meeting, and make understand about the disease process and problem
okay.
behaviors.
So I think there's another question, sir, and you let me know when you want to proceed. But there's a question that, and this is multiple
I think
people have
we can
asked
let
it.
questions very interesting. I find
Yeah,
maybe because I believe that those who are questioning they have a lot of. I think this. I think they must get answered. I think so. I
right.
think
Yeah. So Meenu Venkateshwaran is saying, my mother's recent memory is not
please
bad.
question
Her
please. Yeah.
long-term memory is much worse. Is this also one of the symptoms? She has all the other symptoms that you described. So are you there, sir? Jayashree, you want to take this question?
So I think what Mini is describing is that the long-term memory is much worse.
Contact
Um,
health
go,
professional.
sorry, go ahead, doctor.
Yeah. Yeah, I think Jayashree, you may want to pick up. Yeah.
So typically in dementia, the it is the long-term older memories that get preserved, and the newer learning of information is what is usually uh, forgotten first. So it's important though that you take your mother in for a detailed evaluation. Sometimes when there's also a lot of overlap between other conditions. In depression, sometimes we find that there may be some changes in memory. So it's very important also to take your mother in for a detailed evaluation so that this can be looked into more clearly. But typically in dementia, the older memories are preserved, and it's the more newer memories and the newer learning which becomes impacted first.
Yeah.
Um,
So, Jayashree, we are just waiting for. There are some questions which Dr. Om Prakash should be probably will be better equipped to answer. But there is a question which somebody had asked, that from the person of from the perspective of the person with dementia, what do they feel, and do they have an understanding as to what's wrong with them, or are they at peace or struggling?
Yeah,
So this
that's a very
yeah, yeah.
that's a very interesting question. I know it's a question that a lot of caregivers do ask. We don't know for sure, but definitely one thing that we've experienced and we've seen when we interact with dementia patients is that although they may have difficulties in expressing themselves, recalling things, remembering things the way we do, they can definitely still feel things. So one thing that we always encourage our caregivers to do is to just still give them that hug, give them that physical contact. So yes, if we they may understand the tone of voice with which they are being spoken to, even if they can't understand the words that someone is saying. So I don't know how much a person will be suffering inside, or whether because they're not able to express that pain. I'm sure that if they have other physical pain and symptoms, sometimes it may get manifested in other ways. They may become irritable, may become angry. It could be their way of expressing pain, so maybe they're able to they do feel that, but they can't express it. But definitely they are still able to feel. So that's why we always encourage caregivers to be as positive, shower as much love as they can, even though so much else is being lost, because they still can feel, although their cognitive capabilities are deteriorating.
So, Dr. Om Prakash, this question is for you. Is it a genetic disorder?
Uh, Answer is one third of patients have in genetic genes are there. Genes are responsible. Believe me, I was in genes only, so I'm saying it that way. Somewhere genes are there. We Indians are prone to dementia. We are prone to diabetes. We are prone to dementia. We to understand that this way, some or other way around. Roughly now we are getting almost one third patients having families with dementia. Somewhere genes are very much responsible for this. So it means dementia passes through generation. One case I want to recall at in Iman's days, one girl from Tripura, and that since she's 10 years old, she asked me quietly, "Say, doctor, whether I get dementia?" I no answer because her three generations have dementia. So I no answer. I say sorry, I don't know. I don't know. It's very difficult to believe, but we don't know. If I have families with dementia, likelihood chances, one third chances are there that I will get dementia. That there's a story, and I think so. Yes, there is one third chances that persons having family dementia, they may have dementia in the future.
Thank you, doctor. So there's one question here from Jyotika. What changes can I expect as dementia becomes more advanced over time?
Changes means somewhere the persons if getting losing memory, losing expression, losing thinking, losing self care. We have to assume that how difficult to manage the person with hygiene, with handling his behaviors, with handling his day-to-day all activities of daily living. So those things go mass and mass as time passes. The thing I want to share, rather thinking about the changes, I think if we try to teach, to make patient learn those abilities already preserved, let's try to preserve those functions of the persons as much as possible. Rather than expecting worse, I think that's the outcome. We all know. Can we preserve the functions that already patient retained? So work on those functions. Rather, we are getting he became dependent on us. At least try that. At least go toileting. At least taking a bath, eating his or her meal properly. We start. I think basic idiots we try to preserve as much as possible. Things become worse. That's the part of that's the part because most studies say roughly Dementia survival life is something 5 to 10 years, somewhere in between. So yes, things become worse as time passes.
Mhm.
But care is more important, I think. So families supposed to learn about the care, like you supposed to look after their kids.
Right, right. Yeah. And I think there are a lot of questions around that as to how can you, like what can I do to improve the brain function or slow the progression of dementia? And we also get asked this question repeatedly. So,
I uh, I used to say that for improving brain functions in the early patient dementia setting, try to preserve the function as much as possible. Right from newspaper, right from grain sorting exercise, maybe uh, Jyoti but may enlighten that home task exercise, am I right? So at least those home assignments supposed to do like uh, कंकर दानों में से कंकर निकालना, like cutting the letters. Newspaper लिया आपका A या क या च को काटो आप. So those are basic simple functions. If they you could try, Vartika can try that way, and maybe or try to preserve as much as possible. If suppose somebody doing like farming, gardening, let continue those things. So those definitely these things like somebody has pet and all these things. Let they do manage those pets and those things. So it's time is there. I think they can try. Families may try slow the progression of disease. An important part: drugs, medicines. Compliance with medication is very important because I believe that time passes, family members become more neglect and they neglect the person. They think that okay, everything's over. No, medicine arrests the progress of disease. Almost I think 4 patients where disease stand still, not progress further. So I think they can slow the process if you timely give the medication to the person.
okay.
Yeah, man.
If I
So,
may ask, a lot of times we get questions from our caregivers. And I think there are some questions here about how do we handle, that they're not wanting to take care of personal hygiene. This becomes a big challenge for many caregivers, and it's often a question that we're asked. How is that? What is your advice to manage that for a caregiver?
I think when we talk about personal hygiene and basic ideas that we're talking about, and basic activity daily living, personal hygiene is a very tough issue. I think very tougher, and families because in the initial stages, early stages, easy to make out, but as a disease become advanced, because they need one person on the clock. So before that, I say let at least continue teaching the person about brushing, like bathing, like how to wash the hands because this is COVID time. How to wash the hands again and again. Things like how to eat the food, how to the proper chewing the food, spoon, use a spoon, forks. Means everywhere family members here, the person who caregiver supposed to intervene, teach and again and again. It's not easy. I believe it's not easy, but I think they can try that way to make patient person life more comfortable.
And I think there's another interesting question about whether this should be handled with firmness or are we supposed to just play along with whatever they are saying?
Say the last line, please.
So should their behavior be handled with firmness, or are we to play along with whatever frame of mind they're in? So I think a lot of times this is something that we find caregivers struggling with. That they will want to go out, go back to their office or some the previous place where they used to stay. They'll not be able to understand. They'll be disoriented. How should the family members deal with this kind of behavior? Should they be firm, about it, or should they just play along and find
Yeah,
some distraction or
I got it.
what is it?
Because they find very uncomfortable in unfavorable situations. Unfavorable situations, places, coming out the house, giving new situations, giving new somebody new guest come in the house. they feel very uncomfortable. I think we have a couple of slides later, so we can discuss that issue again.
Okay. Okay. So should we move to the slides, sir?
Yeah, yeah, yeah.
Okay.
So I think that's the title of presentation, like what I'm supposed to do. And before that, this dementia caregiving, I try to dig out that what the caregiving happen at least in India, and what the state of India. Please change the slide, please.
Yeah.
Yeah. So this is something. This studies say that most of the caregivers, not only dementia, of elderly caregivers, these are something is roughly age of middle age, 44, 45, 50. Mainly females caregivers, spouses, daughter-in-laws, daughters, they are the main caregivers, because I have a couple of studies with me I did, and I make out mainly female caregivers, the big chunk of population, it roughly 80 to 90% caregivers are the females. Uh, Mainly they are low education. I mean, this is the rural study. Somewhere they are low educations. Somewhere they are only residing with the care, the patient person itself, and there are a lot of difficulties in all issues. There is financial difficulty, there are social difficulties, there are a lot of care burden, there are issues. Next slide, please. So this is something very interesting, because when they in India, what happened means somebody stay in the house means no work, means no job. But it's not the time, because the person spend hours together, roughly 9 to 10 hours per week with care of elderly, and this is a big number. And if we calculate the cost, it is big cost. So somewhere managing elderly with for daily activity, daily living, for on what type of healthcare utilization means, because this is again big number is amount is there somewhere, because we don't have social support system well as compared to Western world. We don't have, like, suppose government supposed to look after our about our all needs. So family is supposed to bear the current, that economic, the sole source of a lot of income they spend on care of elderly. So next slide please. So what is caregivers basically? uh, तीमारदार कौन लोग हैं, ये कौन है तीमार? जब बात करते हैं कि तीमारदारी होती क्या है बेसिकली? uh, I just try to dig out a definitions. Most of its US law and Indian law say that somebody is above 18 years provides care for others is called caregiver. He is supposed responsible for direct care, protection, supervision, needs of the person. He's supposed to give assistance to other persons who are no longer able to perform critical tasks of personal household cares. Believe me, most of the caregiver, they spend A to Z activities of the persons who are suffering from dementia. So that's the story, means the person involved. I used to say dementia is equal to two patients. One patient himself, second the caregiver who's looking after the patient. So two persons, they are involved with care of dementia. So somewhere the burden is doubled. Looking after the person, looking after himself or herself. Next slide, please. So, so we have no formal care system like your NGO. I think good, they're doing good work. Samvedna Care is doing good work. At least identify those caregiver groups. At least maybe training those families. Somewhere formal care in India is nil, negligible. We need to work on this formal care, because those families, joint system, family system gone. Formal care systems. We need formal caregiving systems. Somewhere to look after this population of elderly, and more particularly for patients with dementia. Next, please. So they are the best because I used to say, I learned last 2 decades from the caregivers only. What I know about dementia, how dementia behaves, how dementia looks like, I learned from the caregivers only. They're the best doctors because they're the person who managing with patients 247. They come to me hardly for 10 minutes. Somewhere they're the best decision makers for their troubled behaviors, even in the COVID time. Because I don't know how they're looking after their patients. Please, next slide, please.
Any
So now
problem?
we work on, I think there's few couple of slides about problem behaviors. Next, please. So behavior is a purpose. That I used to say, somebody is crying, somebody is somebody is asking, somebody is throwing something. It has some purpose. So always consider what the person might be trying to meet with the behavior, what he wants, why he's showing this behavior. Next, please. So somewhere behavior not we, because somewhere we cannot change the person. So most of the caregiver try to accommodate the behavior. They not control the behavior. They don't control the behavior. We try to understand what this behavior meant for. And problem is it's closed. Then check the doctor, please. Next, please. So behavior is triggered. So we identify what the root cause for the behavior. Why the dementia patient is shouting now? Why he's throwing things? Why he's bedwetting? Why this person is just looking here and there? Why he's shouting? Why he troubling others? Why he making people banging the door? Why he banging the head? And caregivers, because the caregivers are the best. I say best doctor. Maybe they know what this person wants. Possible. They try their strategy every day because what's work today may not tomorrow. So some way they change the strategies. At least they're supposed to get support from others. I told try for help because somewhere in this system I think in India what we believe हमें अपना दर्द किसी को बताना नहीं है लोग हंसेंगे लोग मजाक बने कोई बात नहीं जब तक हम चिल्लाएंगे नहीं कोई हेल्प नहीं करेगा समवेयर है ना वो माँ जब तक रोता बच्चा रोता नहीं दूध पिलाती नहीं माँ ना सेम विद डिमेंशिया केयर गिवर्स somewhere if they not cry if caregivers not cry for help no one's going to help either their siblings either their spouses either their family members or so quote unquote relatives or neighbors or even health systems also supposed to be cry for help next please. This is very I think I got lot of WhatsApp and all the person with dementia they just come out of the house and they lost the way. Lot of NGOs are working in Delhi NCR and almost all metro cities. uh, this is not in problem in rural area but more in urban sectors and somewhere because somewhere uh, we have to make the house we have to put signs somewhere रुको या रुकना है आपको एंटर नहीं करना है खोलना नहीं है some way to put sign in the house only and then make sure like people we supposed to let the elderly persons or dementia persons at least have move out with the caregiver have some walk move out. So what he feels restless in the house, let him become less restless. Make some arrangement in the house that he can identify. Okay, यहाँ जाना नहीं, यहाँ नहीं जाना, ये काम करना है, टॉयलेट में नहीं घुसना है, इसमें नहीं घुसना है, किचन में नहीं घुसना है. So those arrangements supposed to make out. Next slide, please. I think that's an important thing because the person on dementia they have some the past memories. Suppose I move out, I supposed to move out of the house with one purse, one car key. I need means if you suppose move out. Same way, the person with dementia they need something purse, glasses, or coat, or something like that. So if you think just these are essential items, put away these items from in front of patient somewhere. Maybe you put in the locker and somewhere. So more important, the second part of very important is ID. I used to say most of the elderly, please keep ID with yourself, either dementia or no dementia, because ID bracelets, like we all software company put ID all that, your tag, put tag and everything. Same ID things with there. They used to when they move out, they at least work on that way. Another problem is agitation. I think that's very important because somewhere uh, in COVID times, I got a lot of calls and a lot of patients they come that they're not able to they do agitated because so try to avoid caffeine, sugar, junk foods, noise. Somewhere sound there's a lot of happening. Sound systems are there. Let make those cut off those sounds and those voices. Somewhere. Uh, those household objects, furniture, somewhere those things are keep near the patient. Somewhere we know that these are like somebody suppose I drink coffee in this say this coffee in this cup only. Keep that cup only. If I need suppose this purse or this comb, keep comb. That person needs that place only. Familiar places, familiar objects, very important. Uh, because they need all the time, and they finish. They couldn't find any like glasses. They shout, they cry, they don't know what they're finding. They're lost that way. Somewhere gentle touch, music, reading, and more important, reassurance. Because we tell them, okay, fine, they lost, no problem. We'll find you one. We try to find. So, and last, very important, don't restrain. Please, restraint is human right violation. Don't restrain your patients. At least if you are keeping in the room also, tell them that you bolted room for your safety only. Next, please.
रिस्ट्रेन से आपका मतलब है बांध के नहीं रखना उनको.
बांध कर नहीं रखना है. इवन कमरे में बोल्ट कर रखना है तो बोल्ट कर रखना है. बताना होगा कि आप क्यों वहां बंद कर रखा है, आपने कमरा क्यों बंद रखा है. Most of the people, I know some families used to lock the dementia patient outside and go to the office and come back. I think that's again the restraint. Restraint is something. It's not only restraint with the say ropes and chains. No, that's not restraint. That's one part of restraint. But restraint is means keeping one person in closed space is also restraint. No is around, no help is around, and sorry to say, a lot of families should do that thing because they have no other way. But let them to at least keep some help or some aid or somewhere somebody look up around in that dementia patient. So then keep dangerous objects out of reach. Uh, Gas knobs, um, knives, sharp objects, uh, ropes, chains. Let keep those things out of the at least in the lock and key, because the person with dementia in fit of rage or fit of anger or what the mood fluctuations, what things he or she may do, we don't know. So at least uh, if you supposed to be keep safety is more important, because I used to believe life is more important. Save the life at the all chances, all things are there. Like suppose house is there, balcony is there. Lock that balcony. No need to go to balcony. Balcony. We don't know that how he may something do, and we don't know at what point of time. So somewhere with confusion he can do. He can anger, control him. And more important, I think if some in different control, try with a glass of water. हम बोलते हैं ना ठंडा पानी पिलाओ उसको. ठंडा पानी इसलिए बोलते हैं ग्लास ऑफ वाटर, इसलिए बोलते हैं ग्लास ऑफ वाटर कि मोस्ट ऑफ द एंगर कंट्रोल बाय कोल्ड वाटर. सो ऑफर वाटर. ऑफर बोलते हैं चाय पिलाओ, अरे नमकीन खिलाओ उसको, हम यूजुअली से इन दिस वे. So just those snacks and those glass of water, at least the persons of the dementia, at least allow him to that let's settle the situation. This is more important rather confronting. आपने ये क्यों तोड़ा, ये क्यों किया. नो, ये तोड़ दिया. तोड़ने के बाद में आपको ये सोचना है कि लेट इट कूल डाउन रादर देन शाउट करना, उस पर चिल्लाना, हमारे इमोशंस एक्सप्रेस करना. आई थिंक दैट्स वी शुड अवॉइड कन्फ्रंटेशन. नेक्स्ट स्लाइड प्लीज. This is very important. I think somewhere they used to say something one word, yes, चाहिए. And we thought, what is happening? at least comfort.
Yeah, I think we lost him, Jashri, sir. You want to pick it
I
up?
think this is something that a lot of caregivers struggle with, and it can be very irritating to the caregiver when the patient keeps repeating the same question or same action over and over again. But as doctor was just mentioning, that it's best to avoid any sort of direct confrontation. It is better to just reassure them, give them some sort of a distraction. Uh, Try to, like he was mentioning, with maybe some water or some tea, or take them to some other part of the house. This is important because they don't actually remember that they're just going repeatedly asking the same question over and over again. So that's why it's very important to not confront and try to distract them from this, and also more importantly to remember not to get irritated because they're doing this. They're not doing it intentionally. Doctor.
Yeah, I think that's very important. Giving reassurance and comfort, please. Next slide, please. So this is very important. There's somebody confused, somebody delirium, and somebody confused, and you discuss the plans. He don't know. Once you say, no, 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 something is there. We will do. We'll choose that way. So never discuss plans with confused person. In even you put sign board like खाना से भी 6:30 खाना खाएंगे हम ये करेंगे वो करेंगे. A lot of signages, those messages help, I think. And learn to recognize repeated behaviors. हम the person's caregiver know कि अब ये गुस्सा क्यों हो रहा है, ये हाथ बैंक क्यों कर रहा है जो खाना चाहिए, इसको टॉयलेट जाना है, इसको ये चाहिए, टीवी चलाना है, महाभारत आएगा, रामायण आएगा, वो he shows some behaviors. So let caregivers understand recognize those behaviors. uh, same bathroom जाना कब जाना, वो he will tell, pull out the cloth and take out, they go, okay, I want bathroom now. So those behaviors can be managed. Next. Next, please.
Paranoia.
Yeah, paranoia is something because that's the toughest time, I think, a family member, because these behaviors family member. But problem is that I started with dementia is plethora of symptoms, lot of symptoms, including paranoia. And believe me, if the paranoia symptoms are so marked, so difficult to, please seek the help of doctor. Medicines are there, good medicines are there. Paranoia can be managed with medicines. A lot of people manage with medicine. Paranoia is one of the symptoms. At least we can manage with medicines. So at least if confused person is there, he suspects something. Okay, hold on. Okay, lost. We will search. We will find out. Rather confronting, rather shouting with him, make his life more avoid arguing and make his life more comfortable. Next, please.
Sleeplessness in sundown.
Yeah, this is something because I started. I think so. Try sleep is very important sign for dementia. So let make sure that let person not to daytime sleep, napping. हम भी सो ले तुम भी सो जाओ. Most of the family caregivers है, तुम सो लो 1 घंटा सो आराम कर लो. Please don't daytime sleeping avoid. If you want to make your night hell, please stop daytime sleepiness. So napping, stop those things. Small meal for the day. That's how I started with. Means you supposed to give not heavy meal in the night hours, and because you put heavy meal in the night of dinner time, then definitely he'll be restless around the. So he will just wake up and just go to bathroom, toilet every time, restless. So let make smaller meal throughout the day and light dinner. That's more important. If you and people used to say eyeball to eyeball contact of भी जगा रहा था, possible, humanly not possible. In the person's caregiver is supposed to wake up for the night, even if he the maid or anything, even paid person cannot wake up throughout the night. So make sure that we do like me, like structured activities in that way. He's supposed to get tired with the physical activity so that he get a good sound sleep. Next, please. That's the word. Lights means. Bathroom light, I used to say, very important. Please make sure bathroom should not off. It should be on all the time. The way to reach the bathroom is also on. That's more important because most of the people stairs should be locked. Most of the people they lock the kitchen door, but let kitchen door locked. Water should be near the patient, near the person, rather than keeping the kitchen or bottles or refrigerator. Let bottle is there near by the person only. I think that's, yeah. So I told drugs are there for control all the weird problems. The good drugs are there.
Yeah.
So I think it's so, as doctor was mentioning, there are very good drugs not only to help slow the progression of the condition, but also to manage various kind of problem behaviors like this paranoia, which is it's very painful for family members to see these kind of symptoms. And yes, these can be helped with medication. So I think one thing that a lot of caregivers are very reluctant to do is give medication. But if you have any concerns or doubts about medication or side effects, it's important to remember that you should always engage in a dialogue with your doctor. Share your concerns, discuss your concerns, and understand what the medications are being used for and how they can help your family member. Um, Alongside these kind of medications, another thing that's very important, which we do at Samvedna, is a lot of stimulatory activities. So we help families learn how they can engage with various activities to provide uh, this kind of stimulation that helps to preserve whatever cognitive abilities the dementia patient may have remaining. So we really try to help families understand what they can do with along with their patient. And the other thing that we also do, which is very important, is we help family members to understand why certain symptoms are occurring and what the reasons may be behind this, and what they can how can they even train other help in the house or other people, family members in the household. So we enable the families to provide more sensitive care, because caregiving for somebody with dementia is very challenging. It's something that does require a lot of input from the family, and one of the ways to make this caregiving more less burdensome is by sharing this whole caregiving process. So as doctor was mentioning, do a family meeting, and get your siblings together, get everybody who's living in the house together, help them understand why the patient is behaving the way they do. And once we found that once families understand what the reasons behind these kind of behaviors are, you can work together as a team to help the patient and also help yourself by not getting stressed or burnt out from providing care.
Yeah. Yeah. So, Doctor, while you were away, we were just talking about some of
Yeah,
the,
I know. I heard. Yeah.
and I think I just want to put up this one question which Sonia Thakur is asking. Sonia, we answered this question some time ago. Doctor had answered that your mother is suffering for dementia for the last 12 years and she's not able to communicate. Do they feel pain and emotion? And how we will come to know if there is pain or if well, apart from physical signs? Very good question.
Sonia, you are doing great job. Please keep it up. Emotions are there. You're not able to make out. We all are human beings. We have emotions in all aspects. From birth to death, we all have some or other emotions. They may not express. They're not able to have those functions. They may lost, but they can see you. They can feel. They can admire in their thoughts, but they don't express you in that way. Please keep it up. Do what you want to do. Do care. Do your best with what you want to do to your mother. So keep it up. I think dementia 12 years, really. Kudos to you.
Yes, sir. So I think we are almost at the end of our discussion, sir.
Yeah.
This is the summary slide. Yeah.
Yeah, yeah. So I mentioned this is dementia progressive disease. We still don't know what finally the final cause. We don't still don't know. We have a lot of theory, lot of research, lot of things are working on. We can slow his progress. Like just like last person Sonia has mentioned, this progression for 12 years. We can slow the process of dementia. Believe me, we can slow. So try early, identify early, and try to make out. Let's slow the progress of dementia. Let our family members, they should be with us. Let we can't cure it, at least we can show, at least we can hope for the future. But somewhere we have to work out this way. We look after, we do care of these patients, and we're doing, I believe that Indian family are doing great job. Really, all the times when I meet any family member, they're doing great job, they're doing the best at the job. I think these all Indian families looking at dementia where, let's keep it up. That's only why that the last I want to say. Any more questions here, man?
Um, I think हमने most of the questions answer कर लिए पर
Yeah.
सर एक एक क्वेश्चन है जो किसी से मुझे पहले आया था कि there are people who have other issues like vision problem है या ग्लाउकोमा है तो उनको फिर उनके साथ उनको अगर डिमेंशिया है या पार्किंसंस है तो मतलब वो एडेड डिमेंशिया क्या उससे भी हो सकता है विजन प्रॉब्लम से भी हो सकता है या अम, आप कुछ इस पे बताना चाहेंगे
I think some audio Siemens. You want to say this complex problem is there. So
Yes.
what I've helped last line. What last line?
So the question is that somebody who is suffering from glaucoma and then he also has cognitive decline, then that is the are they interrelated? If somebody is losing vision, is it
No,
interrelated?
no, 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 not at all, not at all, not at all. Uh, the problem is that glaucoma is separate disease. It is possible that the persons having glaucoma, they may have, because the both systems are different. They're not connected with each other. So glaucoma is the primarily eye disease, and this is brain disease. Dementia brain disease. They may complicate each other. Means both disorder can complicate. With the person with glaucoma, if they have memory problem, they have difficulty already seeing and different thinking also. So they make life more complicated
Right,
rather than
right.
simple one. So complex. If dementia already is big syndrome, if like Parkinson disease add-on or depression add-on or glaucoma add-on, this make life more complicated, I believe. But not cause and effect. No.
Okay, okay. And there's one last question which is a very good question. Can all aging-related behavioral issues be formed as dementia?
No, 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 not at all. Not at all. There's one called this normal aging means we all forget at that age, at the age of say 70, 80, 90, 100. I know my grandma died at the age of 104. Uh, means some you supposed to be this is brain. You supposed to lose some cells every day decay. So there is you can't assume that at the age of 90 years you have memory of 40 years. You can't assume. Somewhere you to think that this is synthesis, normal synthesis is happening, normal decay is happening, and we had the, so but dementia is not normal decaying. This is abnormal decaying, abnormal decline, sudden drip. We can make out this is not dementia. Means this is different from all other elderly of that age group. So no, all age-related prevention not dementia. As age passes, like some elderly, they were stubborn, they are very choosy, they eat like fatting, some eat, they want to eat something like that, or they have something, they want to scold their daughter-in-laws. Okay, I okay, fine. Then let them ventilate what they want to do. But those behavioral issues, they are not related to dementia per se. So I used to say that I had a long time back. This means why females are less dementia in India. I believe they used to fight with each other. They used to control daughter-in-law. So they keep engaged themselves. This again counter exercise of engaging with daughter-in-laws or daughters. So this is great. Means maybe Jayashree can highlight other, but I'm watching those exercises also. Ki what's happening? Why daughter-in-laws, mother-in-laws, they're very keep happy, healthy, quote unquote, sound mind, sound health. This is also good exercise, I believe.
Engaged communication and socialization, no matter what ways you're doing it.
Yeah,
It's important to keep that,
yeah,
those are important things. It's important part of being in the
yeah,
family.
yeah, yeah. So
And I think that's a very, very important thing that you just put up, that we really do need to remember those who forget. Um, I think we, uh, we've been able to cover many of the questions that have been raised. In case we've not been able to respond to your questions, please do get in touch with us. I think we've shared our email and website details on the chat window. Please drop us a mail. One of the reasons why we hold these support group meetings is because we want caregivers to understand that they're not alone in the caregiving process. This is really a place where we want caregivers to share their experiences, learn from each other, learn from the experts that we invite, because this is the way that we can provide better care for our dementia patients. Um, so with that, I want to just quickly thank all our viewers for joining us. And I want to extend a very big thank you to you, Dr. Om Prakash, for sharing your very valuable insights and patiently responding to all the questions and queries that our viewers have um, asked today.
thank you, Jayashree. Thank you, अच्छा ma'am.
थैंक यू सर, थैंक यू सो मच। एंड आपने जैसे केयर गिविंग समझाया है, आज मैंने मतलब मैं 7-8 साल से अब इस एरिया में हूँ, लेकिन आज आपका जो समझाने का स्टाइल था वो बहुत ही एक अलग स्टाइल था और बहुत अच्छे एग्जाम्पल्स आपने शेयर किए। एंड दिस प्रेजेंटेशन, दिस लाइव फीड विल बी देयर ऑन आवर फेसबुक as well as on our YouTube channel, and I'll be sending it out on email also to everybody. So thank you all for coming, and thank you, sir, again, once again, very much for joining.
Thank you. Namaskar. Thank you. Namaskar.